content discussed on this program is often medical in nature and is used for informational purposes only. No content discussed should be taken as medical advice. Please consult your healthcare professional for any medical questions.
Hey, I'm Tori McGee, and this is the Rapid Recovery Report sponsored by ROMTech, the modern technology of rehabilitation. If you're new here, we're doing a series on Thursdays at 4 p.m. Pacific, 7 p.m. Eastern, where we talk to different guests. Sometimes it's surgeons, sometimes it's patients, sometimes they're ROMTech experts. And we're sometimes going to be talking about a very specific piece of equipment here, the ROMTech PortableConnect. There she is, isn't she a looker? And you can check out a little bit more about us and about ROMTech if you are not familiar at our website, www.romtech.com. You can also follow our social links, and all of that's going to be in the description below. Now, what I want to talk about today is our guest. So why don't we just get into it and give you an introduction?
Dr. Matt Russo is a man who is not afraid to stay out on the edge of technology, always looking downrange for that next innovation, that next big idea that he can introduce to his patients to improve their lives faster. Dr. Russo believes not only in big ideas, but also the unwavering foundational notion that all people should live without pain. His passion for changing the lives of his patients is what drives him every day. Dr. Matt Russo, we salute you.
How about that?
Wow, that was quite the introduction, Tori. Thank you. I kind of wish I would have seen that earlier, but that's okay. Thank you for having me. That is quite the introduction, like I said. Ready. You got me ready, Tori.
Absolutely. We're happy to have you. You're based in Scottsdale, Arizona, and you're a third generation orthopedic surgeon, which is pretty cool. I saw your dad in that picture earlier.
Yeah.
And really Dr. Russo, go ahead.
Yeah, it's been pretty neat. I actually joined my dad just about 5 years ago, and he worked with his dad for about 5 years as well when he was before he retired as well. So it's been really fun. I've actually been able to do a few surgeries with him. We've done a couple medical missions together and things like that, and it's been a trip.
That's awesome. Well, we're excited to kind of dig in and start talking to you because you are one of the first surgeons actually that was involved in our IRB study. And for those that are not medical, that's institutional review board study, and working with patients using our PortableConnect versus using a CPM, a traditional passive motion device, with physical therapy. So can you talk a little bit about what you might have discovered during our study?
Yeah, so it was pretty interesting. We wanted to see, if this PortableConnect device really changed our outcomes compared to what we were doing, on a routine basis. I do want to say we gave up the CPM machine years ago, and that's that continuous passive motion machine. Not many patients were using it, up to this study. So that was our only kind of caveat is, hey, but it's really the only thing out there that is similar to what PortableConnect can offer as far as a home device that allows patients to improve their mobility. A lot of patients come in and they ask about the CPM machine, but because it really failed to hold up and it was expensive and all these other things, in the past, we decided that would be a good, at least comparative, device to be able to do for our patients. So yeah, we took our patients and we added just with our normal routine of physical therapy, typically 3 days a week or so, outpatient, which is the way we do knee replacement. And then we added the device on top of it. So we didn't just compare it with just the CPM. I think that would have been unfair. And so, and then we took the other group was we basically took away all of our physical therapy and everything we know about how to treat patients after surgery. And we said, what if we just did the PortableConnect? And our study results really actually were ended early because of the profound effect. All the patients were getting higher range of motion scores, particularly in flexion rather than extension, much earlier than the patients involved in traditional therapy, plus with the CPM. So it was a great, exciting moment for ROMTech.
Yeah, absolutely. That's super exciting. So I know you and a lot of surgeons think that, physical therapy is still a really important option for patients, especially those who struggle with extension of the knee. That you had talked about, flexion was great with ROMTech. Extension is really important too,
Yeah.
when not using the PortableConnect. So a physical therapist must come to the patient's location and work with them on range of motion, or they have to travel a while to go and see them. So, like, is
Right.
there definitive number of rehab sessions usually that is required for a patient?
So yeah, so even though the results showed that physical therapy wasn't necessary for patients if they get the ROMTech, I agree. I do think some patients still do benefit from a few physical therapy sessions, and so we can limit the number of sessions, and so the patient isn't as inconvenienced to leave their home to go to a physical therapy location. Typically, we don't have the physical therapist come to the house anymore. The home-based therapies, with a physical therapist is something in the past. But now we have, the opportunity to deliver therapy with the PortableConnect device through the telemedicine option with the screen. And so my protocol has added a few extension type exercises to the patient's routine while they're on their own at home, because if you think about it, it's just not fair. Physical therapy is only a couple hours 3 days a week. This is multiple times a day. The patients can jump on their bike and work on their motion and without having to go to the therapist. And so it just makes sense that this would offer a higher advantage. But getting the extension is something I stress with my patients. And then if I think they need a little bit more, then we send them to therapy as well. And so I think that's an advantage.
Yeah, absolutely. Well, I mean, and giving patients that option to be able to not have to go somewhere if they don't want to, if they're in too much pain, if they don't have somebody to drive them and it's their right leg or right knee.
The other thing is partial knees as well. I've been using the PortableConnect, and this wasn't involved in the study in particular because we were focusing just on the total knee replacements. But partial knees, I think, are great candidates to avoid physical therapy altogether. The range of motion is not tend to be too much of a problem with the partial knees compared with the total knees, but it's still part of their exercise routine. And my patients love the ROMTech device. So I don't think we could ever go back. So.
Well, that's what we like to hear, that they love it. So
yeah.
Let's switch gears a little bit and have you talk about robotic technology that you're currently using in your practice.
Yeah, so I've been all over the place with robotics, actually. When I first came out, I was a Navio user for a little bit. That's Smith & Nephew's product. And then I got a little frustrated with that, actually. I switched over to the Mako for a while. I still use the Mako for my partial knees, but I really am in love with my total knee system, which is made by Zimmer. It's the Persona. And they just came out with the Russo robotic system. And so I've been using that now at the hospital and not yet at our surgery center because it's just because of the cost right now. But we're working on that. I think that it's changed the way I do knee replacement to some extent, really more focused on a gap balancing technique rather than measured resection, even though my training was more of a hybrid of the two. And so I still use both concepts, but the true gap balancing is really more of the robotic method so that you get a really nicely balanced knee in both extension and flexion. And, so I'm kind of always out there trying different things and different technologies. I would agree with that. And, this robotics, I think, is here to stay. Sometimes I do a knee without the robot and I say, who needs this robot? I got it. It's perfect. But often it does help us, and we can make less significant cuts, especially on the tibia, and to have a really nice balanced knee with a minimal polyethylene. And I think that's to have an advantage.
Yeah, absolutely. So now, as far as robotics go, I know you think they're here to stay. So what does the future in your mind look like for orthopedics and that technology?
Well, what I found as a younger surgeon, is that patients who look to me as their surgeon, I'm high volume, younger surgeon, they're expecting that I use robotic technology. It's not even a question anymore. So I think that's part of the situation here, is that patients come to us, and this is really very much patient driven. And so we as surgeons have to respond to what the patients are hearing about, learning about, and expecting from their surgeons. And I think without that push, we wouldn't have gotten into this robotic realm as quickly, because the patients are educated and they're asking us. And so there's not a single clinic day that goes by that I'm not asked, oh, you use a robot, right? Kind of a thing. And so we have to have that discussion. I think using the ROMTech is just an additional way to show that, we have all of these different things that we use in technology to help us with your recovery, both during the surgery with the robotics, as well as afterward with the telemedicine and things like that. And the technology of the ROMTech with the radius, differing radius, and all of that, I think is really helpful to engage our patients and have them have more confidence that they're in the right hands.
Yeah, absolutely. So now to circle back, and we'll talk about the IRB study again. Did you see a patient morale difference between those who used the PortableConnect versus those of PT? Because that would have been like your very first experience with that.
Yeah, when we start to introduce the concept of the study to patients also, I think that this is part of the reason we had to end it early, because patients who were getting more and more information about what the ROMTech device is, the PortableConnect, were dropping out if they were selected to the CPM machine. And as it went further along and the excitement was growing, showing clear differences in the early period, we didn't necessarily divulge that to patients, but they wanted the new technology. And if they got it, they were excited and they wanted to use it. If they didn't, they didn't want to be part of the study anymore, and they wanted me to give them the device anyway. And so that's what happened naturally. And so I think, and because patients were talking to other family members and things like that, just my own referral system, patients tell their cousin, tells their aunt, and whatever, and then and suddenly they're in my office and say, yeah, I heard you do this, and I heard you have a really cool bike, and so that's part of what's bringing patients back. And if they had one done by me a year ago, and then they have this one, and they saw the difference, and then they tell their friends, that kind of a thing. So the answer is absolutely the morale difference, and so much so that it was impacting the study that we had to cut it off. And so I think that was part of the situation of why we needed to end it. Because it was such a clear difference.
Yeah, that's really funny. I probably would have been one of those difficult patients. No, I want the new thing.
Yeah, exactly. It's everybody. And I live in Scottsdale. This is the Scottsdale life they're pretty specific.
Yeah. So in your bio, you placed a really strong emphasis on the importance of listening to patients and treating them like family members. Now, being a third generation physician, is that something that was passed down and kind of beaten into you from the elders?
Yeah, I would say yes. So I'm a part of a big group now called Ortho Arizona. We were, when I first joined my dad, just in our own little office. We were still a part of Ortho Arizona, but we had our own little office. That's changed now a little bit. We're in a bigger kind of facility. But our office was a very much of a family type feel, and so patients that had been going to see my dad for a long, long time, and now they're seeing me. It's a culture thing, and yes, I guess I would say that absolutely influence. And my fellowship actually was at the Anderson Clinic, and I don't know if you're familiar with them, but they are also a father-son situation with the Angs, as well as his brother or his uncle now. And so there's a lot of family dynamic there as well, which is why I was drawn to that sort of a fellowship in Alexandria, Virginia. And it's been a part of the way I've practiced medicine since I was even in my training.
Yeah, I love that.
Mm-hmm.
It's always interesting when kids decide to go the route of what their parents did, because you see the good, the bad, and the ugly of everything that your parents do for work, no matter what it is.
It wasn't easy. It was not an immediate choice for me. I would have to say that. You know, I was an engineering degree in college, and that situation, it just became more natural. I decided, you know, medicine is really great, and you know, my dad has a passion for this, and talking with my family and all that, and you know, it didn't come lightly though. It was one of those, you know, I'm not going to do the same thing, you know, my dad did. But eventually I saw the light, and you know, the way this is just, it's a great field, orthopedics specifically, but medicine also.
Good. Well, I'm glad you found it and that you love it. It's hard though. It's a hard pill to swallow when your parents were right.
Yeah. Right. Well, he didn't push it either, actually, which was good.
Okay.
Yeah, no, he did not. And sometimes he would say, with the different dynamics in the culture of medicine now, and that's continued as far as all the legal things and kind of the difficulties we go through, especially now with Medicare changes and things like that. It's not as smooth of a road as we want it to be, but still the patient satisfaction and the rewarding part is still there.
Good, good. So there are different things I know that contribute to needing, you know, surgery, and arthritis is usually a big one. So, you know, how important is diet when it comes to the different things that you see and like battling arthritis and everything really?
Yeah, that's interesting. You bring that up. Diet actually has really taken a much more of a forefront with patients in discussion. Anti-inflammatory diet in particular, instead of having to take anti-inflammatory medicines and things like that, and holistic medicine. You know, all of these concepts are relatively new compared to the way, you know, it's just, you know, do what your doctor tells you to do, that kind of thing. And now the whole culture of wellness, you know, and I think is really impactful, and is really relevant with a lot of our patient population, which are younger now, patients who are considering joint replacement to continue their active lifestyle. And so a lot of these patients are into wellness, and that's a big part of their lifestyle. And so there is a part that is relevant with diet and you know, keeping you healthy and active and mobile. And then joint replacement, it just adds in there to keep your joints up to speed with how you feel, you know, how your body feels. And so I do think that's a part of it. But, you know, I will see that, you know, sometimes these patients who are very healthy, very active, have the worst looking x-rays, meaning they have lot of arthritis, you know, but they're able to push through. And I say, you know, I don't know how you're doing it, but you have a tremendous amount of arthritis. And so what I'm getting at is that I don't think having a healthy diet necessarily removes your risk for developing arthritis and degenerative change, which is just normal wear and tear of your body. But it does help patients continue to stay active, mobile, healthier people. And then the upside of that is, if then you decide to do joint replacement, those patients who are active, mobile, healthy with really bad looking x-rays do the best. And we have a lot of studies to support that as far as their recovery, length of stay in the hospital or outpatient, you know, obviously situations, and just overall recovery after surgery. And so I think that's a benefit either way. So good question.
Good. Well, I mean, logically, it makes sense, right? If you have a healthy body before surgery, you're going to have an easier time recovering. It's like, you know, when you get older, it's harder to recover from things. When you're a kid, you're kind of at your healthiest. So, and
that's what I tell patients all the time is that, you know, we want to catch them at the right moment. You know, when a patient comes to me and they're barely scooting by on their walker, I kind of cringe and say, oh man, you know, I wish you'd come to me. And I say, how long have you had that? They said, oh, well, it's been, you know, 6 months. And so it's getting kind of close to that time where that's a long time to be on an assistive device. You know, I'd rather get you right when you're just needing it, maybe, or right before you need it. And so we stay mobile and active, and then your recovery is that much smoother.
Yeah. So now, have you found, you know, patients that have used the PortableConnect versus like that CPM technology in the study, were they able to taper and stop with pain meds faster than might, you know,
Absolutely.
be normal?
Yes. So that was one of our outcomes for the study as well is the how much pain medicine they were taking. And so, yeah, so all the patients, well, the data showed a statistically difference between the patients with the CPM and the patients with ROMTech as far as pain tablets, number of pain tablets consumed. I think one of the big reasons for that is what we would tell patients is, when you feel like you need a pain pill, you can go that route, or sometimes, just get up, off of the chair, recliner, or whatever, get on the device and work it out. And that's actually something patients say, I'm so glad you told me that, because I did that. And then I found out, it really helps to keep the joint moving. And then all I needed was Tylenol instead,
Right.
that kind of a thing. And so I think that was a healthy message for patients, and it's something they can do because the device is there in their home.
Yeah, absolutely. And I mean, a lot of people, myself included, struggle with like heavy pain meds. They're tough on the body, they're tough on your stomach. And so if you have an alternative.
Yeah, so we've done a lot of studies and research about, our pain management threshold, this rapid recovery model. And that's been a big push with total joint replacement. And this device fits in perfectly with that model.
Yeah, awesome. Well, thank you for hanging out with us. And I've got one more question here for you, Dr. Russo. So for those who are considering knee or hip replacement, what advice can you give them, and where can people find accurate info on the subject?
Yeah, so I have a lot of patients who come in and they've Googled everything. Okay, and so there's a lot of miscommunication out there, I would say, especially when it comes to recovery and things after joint replacement. But my website is a good resource. I have a lot of different links from my website, though, to other governing bodies. So AUKUS is there it is on the bottom there.
Yeah. How about that?
Yeah, and then the Facebook, that's a more generic Ortho Arizona Facebook profile, not specific to joint replacement, but that has some information as well. Specific for hip and knee replacement, the AUKUS website, that's the American Academy of Hip and Knee Surgeons. It's just aahks.org, I believe. So we can edit that if that's wrong. But AUKUS as well as our Academy website, which is the American Academy of Orthopedic Surgeons. They have a lot of patient education materials on both of those websites. You can watch videos of the procedure itself if you're so inclined and have the stomach for it, and a lot of information that is geared toward patients rather than healthcare providers and surgeons, which obviously have different language and things to focus on. But obviously, if that's something you're considering, then the ultimate would be just to schedule a visit and we'll chat about it.
Yeah, perfect. Well, thank you again so much for taking the time. You guys be sure to visit Dr. Russo on his website. And if you're in Scottsdale and you need a knee, hip, anything replaced, or just somebody pretty cool to talk to that's really knowledgeable in the medical field, be sure to check him out. Thanks again so much. You guys can also find out more information about us and ROMTech at romtech.com. Follow us, subscribe to our links, and thanks again, Dr. Russo. We'll see you next time.
Thanks, Tori. Thanks.